I think epilepsy is a phenomenon that with what we can explain so many other things, and it's really a window to your brain and window to your science.
Fellow Homo sapiens, welcome back to Epilepsy Sparks Insights. This week we have the star of Finland joining us, leading neurologist, epilepsy specialist and researcher Reetta Kälviäinen. Reetta talks to us about her work on the gene variants in the Finnish population, which has and does play a key part in epilepsy diagnosis, treatments and further understanding of the human genome. Reetta also tells us about the exciting upcoming Kuopio Epilepsy Symposium, which sounds fabulous. A quick one, please don't forget to like, comment and subscribe, because your comment and like will help spread awareness and understanding of the epilepsies around the world. And now, on to our star of the week, Reetta Kälviäinen.
I'm Reetta Kälviäinen, so I'm chair of neurology in the University of Eastern Finland, so in Kuopio, Finland, and also director of the Epilepsy Center in Kuopio University Hospital. We are also one of the member centers of the EpiCare European Reference Center.
Tell us a bit about what your specialization is when it comes to the epilepsies.
Well, I have been working within epilepsy as a medical doctor and then neurologist and researcher like 40 years. And since being in medical school, and I'm clinical doctor, so mostly all kind of clinical epileptology, working a lot of in hospital earlier, but now as professor and researcher and university person, I'm doing all sort of epileptological research. But my main interest lately has been perhaps two important things. First, I'm looking to find biomarkers for epilepsy in that respect, that how we could better tell the prognosis of specific epilepsy disease to a person. And I believe that there is not a single biomarker that could tell that prognosis and perhaps tell which drug would help a particular patient, but it could be a sort of combination of biomarkers. So there might be some blood-based biomarkers, there could be some genetic biomarkers, there could be EEG findings or imaging findings, and then we could combine these different kind of findings with some kind of computerized artificial intelligence-based tool, and then we could then interpret it together with the patient. So the doctor and the patient would then together interpret what kind of epilepsy the patient has, and then perhaps think about what is the future, what kind of medication we could use. So this is so-called shared decision making. The other thing is that as we are a center or member of the EpiCare reference network for rare and complex epilepsies, I'm of course interested in rare epilepsies, and particularly one disease which is progressive myoclonic epilepsy type 1, which is very more common in Finland than anywhere else. And therefore, I've seen most of the patients in the whole world, I think.
Wow. And just for people who aren't familiar with the country of Finland, why is it so common in Finland, this type of epilepsy?
This is a very large country, area-wise, but the population at the moment is 5.6 million and was even less earlier. And earlier days, there was a sort of population was very isolated. So therefore, some gene variants have become more popular than others. So for some diseases, we really have a so-called Finnish disease inheritance. So some even rare diseases are more common here, and then some disease we don't have at all. So for example, progressive myoclonic epilepsy type 1 is very common, although also rare here in Finland. But then progressive myoclonic epilepsy type 2, which is Lafora disease, that is non-existent or nearly non-existent in Finland. So therefore, we have got quite unique inheritance. And especially this is true in the eastern and northern parts of Finland, where I work in the University of Eastern Finland. So this is a very interesting place to work. Also, of course, a little bit sad place to work because population is very somewhat more sick than in other parts of Finland, in the western and southern parts of Finland.
But I've also read that as a result of this unfortunate situation, Finland has actually kind of embraced technology and genomics and actually is using this information to try and prevent and manage these genetic diseases, including rare epilepsies.
Exactly. And we have, of course, done a lot of huge work for these diseases that belong to the Finnish disease inheritance. We have investigated a lot of them, and that work also benefits other diseases. But also, some of the common variants are also more easily than seen in some of the populations here in Finland, and we can use also that to also detect and investigate the more common diseases. And we have, for example, there's a very successful FinGen project going in Finland, where we have discovered the genome of over 500,000 inhabitants in Finland, and then we have connected the registry information of all kind of the registries, like mortality register or drug information of these patients to the genome data, and that has brought a lot of new data and is going to continue, of course, here in Finland. That's a very successful project called FinGen. There's also a lot of public information for everybody to all over the world to be used.
That's fabulous. And actually, just that last bit you said about this data and information being used by the rest of the world, it's a perfect example, I think, of how research into the epilepsies doesn't solely benefit the individuals in the study or even the local population or the population of the country, but actually even benefits people around the world, and even not just those with the diagnosis, but other diseases which are very similar.
That's absolutely right. And epilepsy is not only seizures. Epilepsy is a symptom of a brain disease. And brain health is everything. Belongs to everybody. I think we should think so much more widely, and our genome influences to everything, including our brain health and diseases. And so I'm so frustrated when people think that it's only epilepsy, and I don't want to come to your education about epilepsy because I'm not interested in epilepsy. I think epilepsy is a phenomenon that with what we can explain so many other things, and it's really a window to your brain and window to your science.
I couldn't agree more. And also, even if people don't yet see that, which would be silly, but even if they don't see that side of things, epilepsy is one of the most interesting diseases ever. It is just so... It can be so complex with so many factors coming in as to what symptoms are, as you said, more than seizures. It is just, I shouldn't say mind-blowing, but it kind of is in that exciting way, right? Intellectually.
Yes, absolutely. Yeah. It's of course demanding intellectually, but also very interesting. And if you just open your mind and start to look for it, then you are really excited, and you cannot stop anymore.
Tell us a bit about this conference that you are holding in Finland soon, that's coming up, and why it would be good for people to attend, including people who maybe have not shown interest to date of the epilepsies so far.
So we are going to have a Kuopio Epilepsy Symposium on 13th to 15th of March. So it's going to be physically in Kuopio, in our city theatre, very, very nice place. but we are going to also have it remotely, so you can participate globally from anywhere. Very important. It's very multidisciplinary, so it's for doctors, clinical people, but also for researchers. So it's very for everybody, professionals interested in epilepsy. And we try to approach it very scientifically. So this part is in English. We have another program also that we are sending remotely, which is in Finnish language, which is for nurses, because it's of course important that we also have this kind of activity, and we really want to build up the International League Against Epilepsy nursing section also to Finland, and this needs to be done in Finnish. But the main program, 3 days, is in English, and we really also concentrate on diagnosis of epilepsy, different etiologies of epilepsy, how we in a modern way can detect epilepsy, but then we go also to science, to genetics, to tissue detection after epilepsy surgery, and different ways of doing research. We have also abstracts, scientific abstracts competition. We reward people who are doing science in Finland and elsewhere, and of course meet together, especially on site. Important topics also are different forms of status epilepticus, and we are talking about also status epilepticus care pathways. We are going to update the current care guidelines for status epilepticus in Finland. What we already have done, we have been building the care pathway for elective patients in Finland, and we are really bringing up how we have the care pathway from the start of the diagnosis to the complex and rare epilepsy situation, and even to the epicare discussions and to the European level. These are very important aspects. So status epilepticus and care pathways.
It's from March the 13th to the 15th, again, being held in Finland. I'll provide the link to that below this recording. Will you have any patient speakers at this event, or it's patient-free?
Usually we do a lot of work with patients, so patient and public involvement is crucial for all our activities. In this case, we have a very crucial involvement of the patient organization in Finland, which is the International Bureau for Epilepsy chapter in Finland, Epilepsialiitto, and the speaker will come from Epilepsialiitto. So there is no patient involvement so much. This little bit also is due to the different kind of regulations that there are for drug marketing that we need to take care of. But in some other meetings, we really more and more emphasize, as I said, the patient public involvement, and also include it in our research more and more.
We hope to see you at this conference in Finland. It's going to be heaps of fun. And again, if you haven't done any work in epilepsy yet, don't let that hold you back, because this is one of the most interesting diseases and goes way past seizures alone. Thank you so much for joining us today, Reeta. It's been lovely to have you, and great to see you again.
Great.
So I don't know about you, but the evolving human genome and all that encompasses, I find fascinating. Thank you so much to Reeta for providing us with a glimpse into this and her extensive work, both in Finland and around the world. To learn more, check out the Kuopio Epilepsy Symposium. You can find the link below this recording. Again, if you haven't already, please don't forget to like, comment and subscribe, and see you next time.